Hi, I'm Ines Buki. I'm a country director with Chemonics International, a global development organization, and I'm implementing the Global Health Supply Chain Management project in Rwanda. My project is about building a resilient health supply chain workforce in Rwanda. I've worked in several health-related projects that provided technical assistance to health supply chain managers in various technical areas, and one of them being to conduct forecasting and supply plan of health commodity, funding mobilization through donors and government for the procurement of health commodity needed, and therefore ensuring uninterrupted availability of health commodity. The technical assistance process used is built up to ensure country ownership from the development of tool, process for data validation and assumption building to training on those different concepts and tools. Challenge often arise when in-country stakeholders reduce focus on the process, the approach then moving out from a capacity building effort to a completing assignment approach, increasing then pressure on project team to complete tasks with less disease program guidance and therefore running risk of stock out for life-saving commodity. My project vision focus on increasing awareness for strengthening health supply chain intervention through effective and impactful leadership by using evidence-based data, country experience, and understanding any gender specificities and factors influencing country ownership. The recent COVID pandemic has confirmed that a well-functioning health supply chain system has been very essential to combating challenging logistic constraints and ensuring health commodity availability get to the last mile. The delivery of those commodities all the way to the last mile has been possible because of skilled workforce and health systems that are staffed to provide patients with the needed support. However, the reality is that years of investment in the health supply chain management have in many countries failed to produce national systems that effectively operate the supply chain without external support. Then how can countries get prepared to become self-reliant for the next pandemic and build a strong health system and workforce that can take them through the crisis? Ms. Toby Bush, a senior technical advisor in pharmaceutical system strengthening, working at USAID Washington, drew down a digital sketch about resilient and strong health system. The concept of country ownership has become more and more a requirement in donor policy and strategy, yet definitions vary and there is a little clarity and great diversity in how this concept is articulated and practiced by donor and recipient country. Over the last decade, we've seen this concept vary from ownership to resilience and to now localization effort. What we've done so far, we've reviewed the 5 R's, key dimension of systems, roles, relationships, rules, and results, and applied through different country intervention, mainly focusing on Chemonics project. We've also reviewed from the literature aspect of country ownership around power and legitimacy, commitment and responsibility, capacity and accountability, and where leadership concepts have been used and considered as a tool that could solve challenge. We've developed questionnaire for interview. Interview will be conducted from few selected countries having context similarity as Rwanda to review evidence gathered from government stakeholder and donor in the sector. We hope that at the end, to understand factor preventing health supply chain system to become more and more efficient and bring more ownership at country level. We actually also would like to continue and partner with WomenLift East Africa to bring that concept of country ownership into life and contribute to any intervention that could support country to actually become resilient and build a health system that is very resilient. I would like to appreciate all the East African WomenLift organizer, presenter, mentor, coaches, learning about my strength, weakness, and opportunity for growth through the different learning touchpoint, journey plus coaching and mentoring, and how I can become intentional about my leadership style have been a big awareness for me. Thanks to my fellow women in this cohort for sharing your journey, vulnerability moments through the different breakout rooms. Thank you.